Hi guys! So I'm here again to give you another vlog. But, di ko alam kung sino vlog.
Tungkol kaninang bagong case natin today?
Well, nag-scan nga kanina and then hindi ko alam, yan dami. Pero ito, one of the Team Payaman's guy, si Mentos. Kasi recently, we did this case, right? And I think it's worth sharing kasi feeling ko a lot of people can relate with his case. So this is a very complex case and I want to share this and for also yung mga tao to be aware that what are the possible treatment options when it comes to treating that type of dental problem.
Doc, di ba ang dami niyang kulang ng ngipin? Paano po yung plano niyo para gawin yung kanyang case?
Well, number one, we have to study the case first, diba? I mean, we need to get the x-ray, the panoramic x-ray. We have to check the teeth, the mouth, and soft tissues, the gums, clinically to check if there's a problem. We have to check also the teeth, the condition of the supporting structure, the bone, and everything. And finally, we have to address that missing area. You know what? One of the problems with missing tooth kasi it can create more trouble. Like yung ngipin pwedeng umuga because it's not it's not stable kasi hindi na sila hindi na sila as one, hindi na sila nagtutulungan to support the pressure coming from during mastication. So pag gumunguya, kumakain, pag kulang-kulang yung ngipin, ang tendency pwedeng gumalaw ang ngipin lalo and it can damage. So isa sa mga reason na kailangan dapat nating ayusin beyond aesthetics, no? Kasi syempre pag walang ngipin, syempre medyo may space at kailangan kung may mga one set apart na yan, ma-address din natin. So mamaya-maya makikita mo.
Sarap dito, parang para sa akin convenient tong lugar. Parang akong bine-baby rito. Parang alagang Apostol. Parang feeling ko di nila ako papabayaan. Ito na airplane.
Yan, rinse tayo sir for 30 seconds.
Dok, masakit yung dito ko.
I-explain natin.
Ano siya, parang sensitive.
So, nung pumunta sa akin si Mentos, akala niya may sakit sa ibang ngipin. But when we took the panoramic x-ray, we found out that there's problem on tooth number 22. Okay, there's a pulpal infection. Ibig sabihin, yung pulp doon is medyo infected na and it's causing pain. And it's radiating from that side of the tooth, upper left quadrant. So akala niya yung ibang ngipin, hindi niya ma-pinpoint exactly kung saan man yon. But of course, that's the reason why we get all the diagnostics, we check the teeth clinically to confirm kung saan ba talaga nanggaling. So we did root canal on tooth number 22 and then it fixed the problem, the pain problem. So wala na. Yun dun pala nanggagaling sa isang ngipin na yun sa may tutu.
It's me.
Pogi niyo, Dok. Mata ko lang din, Dok. Pogi din. Siyempre, medyo unahin natin si Dok. Medyo purihin natin para di tayo masyadong saktan mamaya. Ngayon si Dok, medyo kino-complain para hindi masakit mamaya yung mga. So yun pala yung root canal. Parang nagpasta daw. Roof. So pag root canal, madilaw ng bahay. So linis. Yun pala yun. Butas-butas na yun. Kinakabahan ako yun. So dito na tayo. So go. Salamat sa 31 years na pagsasama natin sa mga kaibigan ko. Sa Team Payaman, salamat sa inyo. At nagkasama-sama tayo. This is the, basta pasalamat ako sa inyo lahat. Yan. Sa mga sumusuporta sa akin, maraming salamat. Yun, siguro, higa mo na.
Pag sinapangit na wala kang naramdaman, gumagana na yung anesthesia.
So, palisin niyo yung balin. Palis lang.
One hour later.
Saan kang tulog mo kanina? Para akong nag-ride ako, pili ko nagmumotor ako. Nakarating ko ng Palawan. Tapos sabi ko, oy, okay na. Sobra ka na, ginawa mo namang hotel ito.
And also, napapansin nyo, ang daming missing teeth. Medyo, ano na siya, parang, of course, aware of the current situation. He actually thought that it's hard to fix the problem or sabihin natin medyo hopeless na case.
Lahat sila po, nilalait nila ako, bungal. Ngayon, kayo magkwento pag uwi ko dyan. Sa kotse pa lang, dudurugin na kita. Nakalagay sa kontrata, Mentos, paglabas mo ng pinto, pagbukas ng pagbukas, kompleto ka na. Kaya tatandaan mo to, hindi lahat nasa ilalim.
Lahat
Nasa
ilalim.
Oo, dahil ako lang ang nasa ibabaw.
Wow! Gusto ko sa'yo pa. That's the spirit.
But, syempre, hindi niya alam na may solution pala, na easy solution, but a permanent one. Syempre, we have to give what's best for the patient. That's why we recommended zirconia fixed bridge. Number one, because of the missing tooth, no? So, ang tendency kasi nun, nagkakaroon ng resorption of the bone and supporting structure. That's why implant is not like super easy to implement because we needed a bone for us to place the implant in a way that it can be used as abutment. So, for this case, mas maganda, the best treatment option, hindi tayo mag-aantay ng matagal na panahon because with implant, it requires like years, like grafting, placing the implant, medyo matagal yon. A minimum of like a year for us to complete the treatment. Whereas, when we do our zirconia fixed bridge, it can be done in just a week.
Dok, nakikita kasi namin sa x-ray, ang dami niyang bulok ng ngipin and may mga dental fillings. Hindi kaya, Dok, makompromise yung tibay ng pagkakapitan ng ating bridge?
Okay, yeah, that's a good question. With filling material, kasi it's a good thing that they filled the tooth because it prevents further damage. And also, establish the tooth structure para hindi siya mag-collapse. So, ang ginagawa natin dito is like we remove the old restoration and we replace it with a new one. And ang gagawin natin na material for the final is zirconia, which is stronger than the filling material, yung composite. So, technically, hindi siya mag-weaken, magiging stronger pa yung ngipin.
Dok, hindi ba naging mahirap yung preparation ni Mentos?
Well, hindi siya mahirap yung preparation niya kasi it's a bridge, it's a ideal preparation lang kailangan mo dito. And okay pa naman yung structure of the teeth. And yun, it's not that complicated.
Dok, may epekto ba sa gums at bone natin kapag binunutan tayo ng ngipin?
Yeah, for sure. Once you extract the tooth, in the first year, there will be 25% loss of bone agad-agad. So, that's just the first year, no? So, yun yung problem pag nababawasan or pag natanggalan ng ngipin. Kasi yung buto ay nagre-recede talaga.
Dok, ano pong kinalaman ng ngipin sa pag-recede ng bone?
Yung ngipin natin, it has a root and the root holds the bone together. Without the presence of the root, the bone will collapse. There's no reason for the bone to stay there. It's because wala na yung root. Next step natin, is to get the impression, no? Yung impression naman, hindi siya yung the usual, yung dati na sinusukatan ka. Wala nang ganon. Ito yung gagamitin natin. It's called intraoral scanner. Tapos, binabato yung file sa computer dun sa CAD-CAM, computer-aided machine. So, yung ginagawa nun is parang piniprint niya yung magiging ngipin mo. Pagkatapos nun, pag okay na, i-layer yun ng porcelain. Stratified dahan-dahan. Makuha natin yung bagay na design for you. Hindi masyado maputi, hindi rin madilaw. Bldg siya sa ibang ngipin. Tapos dapat hindi siya ganun ka-striking. At saka yung bite ayusin din natin medyo problematic. So after nito, kukunan ka pa ng face bow registration para makuha natin yung symmetry.
Parang mukha akong ano rito, mabait.
Bumata.
Tanggal mo na lang, hindi ka na nakakatawa eh.
Sa dating si mukha akong matapang na laging sa pakan. Pare, masanay lang ako. Sanay lang akong kulang. Ngayon kompleto na. Shi.
1 week later.
It's time! Balik na tayo sa room number 7.
Ganda, Bad. Masaya ako para sa'yo, Bad. Masaya ka naman, nakaka-smile ka na ng todo.
Oo.
Hindi ka... wala na kasi buo na eh. Paano na ngayon? Yeah. Akala namin wala nang may kayang gumawa nun eh. Pero buti na lang, kinaya. Balita ko, 10 doktor daw ang nagtulong-tulong para sa ngipin ni Mentos eh. Kaya maganda naman yung kinalabasan. Mas lumabas yung ano niya, yung pagiging masayahin niya kasi nakaka-smile na siya ng buo.
So talking about the results here, as you can see, we have completed that area na walang ngipin. I mean, we have filled in the spaces through zirconia bridge, layered with porcelain, and with a tinge, a little bit of pink aesthetics, just to mimic the lost gum. Although, you know, there's a little bit of a difference because it's really hard to mimic the color of the gums, especially pag medyo sa situation na to. We're looking at the volume as well, not just the color. Anyway, we brighten the smile. Mas brighter na yung smile. And also, napansin ni Mentos, no, na medyo lubog dati yung kanyang lips, especially on the upper left side kasi wala nang ngipin doon. Okay? Lumulubog kasi talaga ang lip sa area yun kasi walang sumasalo. The role of the teeth, it's actually setting the muscles din. Yung contour of the lips. Let's say for example, nakalabas yung ngipin mo, nakalabas yung lips mo. Pag nakapasok yung ngipin mo, nakapasok din yung lips mo. Pag wala ka ng ngipin, babagsak siya. Babagsak ang iyong lips. So, when it comes to aesthetics, we're not looking at the teeth only, but we're also looking at the face, dentofacial aesthetics. So, sa case niya, nag-improve not just the smile, but also the lips. So happy for him. So how can we protect this kind of beautiful smile? Of course, not just, building beautiful smile, but also we need to protect kung ano yung ginawa natin. So, we advise Mentos to have a night guard and he needs to wear it, okay? So, ang night guard kasi, it will protect the teeth from grinding. Kasi once you have a new sets of teeth, of course, it's still foreign and then your body will still adapt with the new sets of teeth. Based on the research, it will take a minimum of 6 weeks for the human being to adapt with the new sets of teeth. And also flossing and using the super floss from Oral-B. It's really good. Pinlag pa, no? It's actually one of the best flosser. If there's something in there sa bridge na na-stuck, mas maganda yon because it has para siyang foamy something that could remove yung nakatago doon. Of course, ang pinaka-goal natin dito is to keep your teeth and gums healthy because if you don't brush your teeth, of course, there will be problems, especially sa gums. When we do our restoration, especially with this kind of restoration, we made sure that the bite is on point. So we run it with our T-scan machine. It's a digital occlusal analysis machine where we check the bite distribution. So after getting that, checking everything, okay na. So medyo mas confident na kami that the restoration will last because the longevity of the treatment will always depends on a lot of factors. Number one is occlusion. Okay, dapat maayos yung kagat, walang interference, walang maling kagat, and also the protocol of bonding, the preparation, everything, the usage of materials should be properly implemented. So, a very, very technique-sensitive treatment must be done accurately. So, having an apostolified smile such as this, of course, may duty tayo. Hindi pwedeng maganda na yung ngipin mo, hindi mo na siya alagaan. Okay? Masisira siya if you will not take care of it. Masisira siya kung hindi ka magsisipilyo. So, magsipilyo ka. Okay?
Okay po, Dok. Dapat pala talaga. Responsible yung mga pasyente para alagaan kanilang ngipin. Dok, tuwing kailan ba dapat bumibisita sa dentist?
You have to visit your dentist every 6 months. The reason why is that we need to check if there's something wrong because you're always using your mouth when you eat, diba? We eat what? 3 times, 5 times a day. We eat chocolates. We put a lot of things in our mouth. And we clean our mouth, but most of the time, may mga nanineglect tayo. So it requires a professional cleaning and also assessment from your expert.
Dok, maraming salamat po. Ang dami ko natutunan ngayong araw.
Thank you guys for watching and I hope to see you all on my next vlog. Goodbye.